Adenocarcinoma of the colon is the most common malignancy of the GI tract and is responsible for 10% of all cancer deaths. The primary function of the colon is to reabsorb water and nutrients and ease the passing of feces. The intestinal epithelium consists of simple columnar epithelium with deep crypts with stem cells and mucus-secreting cells at the bottom. The food is moved slowly for optimal absorption. Mutation can occur in stem cells as they move up the crypt, proliferating and differentiating, and can cause benign epithelial polyps, called adenomas, which are outgrowths from the colon mucosa and are precursors for adenocarcinoma. The two main genetic pathways are the APC beta-catenin and the microsatellite instability pathways. APC is a key negative regulator of beta-catenin, which is a component of Wnt signaling. Loss of APC function leads to beta-catenin accumulation, which activates transcription of genes that promote proliferation. The microsatellite instability pathway has defects in DNA mismatch repair and accumulation of mutations in the microsatellite repeat regions. Both pathways involve mutations of other genes. These mutations lead to the formation of cancer cells as they promote growth signals, prevent apoptosis, allow for unrestricted growth, and are insensitive to growth inhibitory signals. Epigenetic risk factors are low dietary fiber, high fat intake, alcohol smoking, and low amounts of exercise. These mutations cause stem cells to form lesions involving a single crypt, then they turn into small benign tumours and then progress into invasive adenocarcinomas. Different polyps formed and histological variations are important in determining the likelihood of progressing to invasive adenocarcinoma. There are 5 main types of polyps, which are tubular, tubulovillous, serrated neoplastic, and hyperplastic. Depressed polyps also have a higher risk as they're more likely to have incomplete resection. Histological variants include signet cells, medullary, extracellular mucin, serrated, and cribriform carcinoma. Tumour staging is classified on the level of invasiveness. Malignant tumours spread and metastasize to lymph nodes, bone, lung, and most commonly to the liver. Early diagnosis is important due to the high prevalence of adenocarcinomas. Colonoscopy is recognized as the gold standard method for visualizing the colon and allows for the investigation and endoscopic removal of polyps. Prognosis factors involve the depth of invasion and the level of metastasis to the lymph nodes. Colorectal cancer often develops insidiously and can go undetected. Tumours on the right side of the colon are associated with fatigue and weakness due to iron deficiency anemia. Tumour growth on the left side causes occult bleeding, changes in bowel habits, and cramping or discomfort in the lower left quadrant. The specimen shown here is from a 65-year-old male who presented with 7 days of aching in the left iliac fossa, consistent with tumour growth on the left side colon. This specimen shows a large ulcerated carcinoma with small pulpomatous growth that has infiltrated the lymphatics but not reached the lymph nodes. Treatment includes combination chemotherapies, targeted therapies, and surgery. Invasive carcinomas with microsatellite instability respond poorly to chemotherapy because they have prominent mucinous differentiation. There are palliative approaches for patients where surgery is not appropriate. The underlying genetic mutations impact their prognosis and guide therapeutic interventions, meaning there is a clinical significance in understanding the disease process of adenocarcinomas of the colon.
Created using Powtoon.